next company that we will move to is Tata Medical. Co-founders are Rebecca Bayhead and Katarina Hedbeck. Welcome, Rebecca and Katarina. Nice to have you.
Thank you.
We would be very pleased to also hear your story, entrepreneurial journey, and get some insights for our audience. So, stage is yours.
Sure, thank you. Robin, would you mind sharing? Thank you. So, Katarina, do you want to kick it off, the usual one? Now, I know we've heard some about it already because we are also a clinical innovation fellowships team originally.
It was great to hear previous talker, and I think we can agree that this journey is the greatest thing ever. I think we can start off with that one. It's I feel so lucky to be on this journey together with Rebecca and Christopher and the rest of the team and everything. No, I think it's if we. Yeah, I can start actually. 2021 has been an amazing year for us. We have managed to get the CE mark for our first product. We managed to get the company ISO certified, and we also managed with a European Grand Slam. But if you do this slide, and then I get back to the Grand Slam.
Well, I can start since also this is totally unfair, and this is how we worked the entire time, that I created a presentation that Katarina got about 2 minutes to look at while in an investor's pitch, because I sort of just needed is it good enough or not? So this one is about the journey we've had with the EIT Health, because, you know, we are really, we are an EIT Health company. From the Clinical Innovation Fellowship program that you now heard about with needs and all of that, observation, need statement, not having the solution built into them, all of that. It's a brilliant program with based on the Stanford Biodesign process. So you have a process to arrive at a solution, not necessarily a solution, but a need that, you know, where you have the customers already there, the healthcare system needs this. So very good start with the Head Start program. I know that you have some of you asked about funding. That is something that we really recommend. It's not a lot of money, but you can get it at an early stage, which is really hard sometimes to get funding at an early stage when you have more or less just an idea. The catapult was, we still speak about it, like in 2018, and both Katarina and I can go totally nostalgic to speak about, oh, that was the best thing ever, everybody's friends, and, you know, you're competing with each other, but then you're put in a room and you're supposed to give feedback on your competitors' slides, and you forget that you're competitors, like, maybe you should tweak your business model a bit, and then the next day you're up on stage and you're competing again. It doesn't matter who wins because everybody loves each other. Maybe not the entire truth, but it's like it's a brilliant place to be.
And it's also one of the thing, if we were to mention 3 best things that really made an imprint on us, the entire catapult journey was amazing, and it was a game changer for us. And at that point, we hardly had any money, and it was one of those, you know, make it or break it situation. And it not only gave us some money, but it also gave us hope, I think, in a way. And then you realized you met doctors, hospitals even more, and it gave you energy to keep on going, really, at that point. And we learned a lot.
Yes, we did. And I think we got even deeper into the EIT Health from that one, because it's after that we joined the Investors Network and the mentoring and coaching network. We started with the matchmaking events, all of that. It's somehow born from the catapult. And the last one here is the EIC funding, and Katarina will come back to that, so we can take the next slide, which is about the need, our favorite need that were from the program. And we were at the Kids Oncology ward, which was pretty tough, especially as a parent. You see other parents that are suffering something that you can't even, like, not even your worst enemy you would wish this upon. But what they had some problem with the IV lines. Like a kid that feels healthy, even if they have cancer, they're gonna run around. And they had tubes, IV lines being pulled from the patient while in use, which is, of course, a horrible thing. So a part of the program was also to see if this is just a need for this specific clinic or if it's a larger one. And it was a freaking large problem. Katarina can give you the numbers. We're speaking about billions of tubes being used every year and a dislodgement rate of like 10%. Imagine like every 10th IV line is being pulled from the patient, and most often by the patient themselves because of some mental health, like Alzheimer's, these kind of things, or that you are very mobile, like a kid or a drunk. There's all sorts of weird accidents. So that is what we're trying to solve, right? So next slide is about the solution. Because also, again, a part of the, Robin, if you wouldn't mind, thank you. So a part of this is also what is already out there. We're not supposed to invent the wheel again, right? So the solutions that are on the market, they are fastening devices, more bandages. You can, you tie the patient to the bed even, so you can't have them pull out the line. It's the most insane things. And more bandage and more bandage. Subcutaneous anchor, so then you can pull a bit harder and nothing will happen. But some of these patients, they pull really, really hard. So we said that, okay, we do the opposite. We do it as a weak link instead. A weak link that we then pitch to the nurses. What would you like from this? What is the user requirements? And like double valve system, nothing can leak. In case of an accident, you pull the line and the patient is happy because they pulled the line. Now they don't have a line anymore, sort of. Nothing can leak out on the floor. We're not losing the drugs. They're still in the bag, in the line, and you can clean this and you reconnect it. And then it's like nothing has happened. That is what they wanted. And that is what we set out to build then in 2016. So next slide, please. So here, Katarina.
Yay. Yeah. Yeah. No, so 2020, we managed to get the EIC accelerator. And then later that year, we got the fast track to innovation and then the Eurostar. So it's the grand slam. And it's in total a lot of money that we, 5.5 million euros that we partly share with hospitals and consortium partners across Europe. But we are obviously truly grateful for the grant, so we can bring our product to the market. There is obviously a reason why the European Investment Council has, decided to give us those grants, and that's because the connector it solves so many problems in so many different areas, and in total there are 16.6 billion tubes used across the world every year, and 10% get disconnected. There are patient injuries, there you could spill toxic medication, there is plastic waste, there is a unnecessary consumption of the time that the nurses spend, because it takes a lot of time for them to just reinstate therapy. And one of the advantages with our connector is that it saves 90% of the time to reinstate therapy. And with the overload of work that the nurses does today, it's obviously really, really good. And also it would prevent toxic spillage, a spillage of toxic drugs. So if we grow, it changed to the next slide and talking about the team, because we managed to grow with these grants. We have, we sponsor a PhD student at a university, hospitals for, animals, and we do a lot of things. And we have managed to grow the team so we can actually move faster towards the market, and we will reach the market. So those things are amazing. The first photo is from the Clinical Innovation Fellowship time at the hospital. And the other picture is from this summer when we were having lunch, everybody at the restaurant in downtown Stockholm, when we managed to see each other after a long, long time of pandemic, and everybody started to get their shots and we could actually meet. So we have this amazing team. We've added more and more people, and in Stockholm we're very happy, and it's great with having a lot of people from different nationality backgrounds and a vast background from different fields. So we managed to put together an amazing team with the competences to bring a medtech product to the market. And then we have everything that EIT has helped us with, and if I
we want to highlight
we want to highlight it and also say thank you, because it's we're really happy for the contacts, the networking, the peer-to-peer, the catapult, and some money. And Rebecca.
Thank you. No, but the team, like, and the people that it's already been mentioned that you can't do this alone. Now, in the beginning, Katarina and I were, we did it just the two of us, operational, right? We have a third co-founder, Christopher, who's an MD. So he's our spy at the floor, which is brilliant. But then, how do you, the first time you need to bring in staff because you realize that we need to start growing. And that's really, really scary because all of a sudden you need to pay people salary properly. Like if it's just Katarina and I, and we can't, like, okay, this month we have to live on nothing. So, okay, fine. But when you have people in, so these grants has been invaluable for us, of course, to be able to have that, to now have a burn rate that I'm afraid to mention even. Like, what do we have, Katarina? Like
150,000 euros a month.
Yeah, a month. So then, you without sales, that's, you need to survive on something. So the matchmaking, that's been really brilliant for us. And not only for, the consortium that we have built and got it funded, but also from the investors network, or just having, like now, what was that? Like 2 weeks ago or something, I could pop off to a German clinic and speak to them, because there is an EIT Health Innovation person belonging to that clinic who can help facilitate everything. I think the next slide is just a very nice
example. Before we jump to that one, the mentors that we've gotten through EIT, they don't just stick around for what they were paid for from the beginning. They keep on helping, or shouting out and happy words, and if we need help, and always a good advice and friendliness, and that somebody you could just call, and they've been amazing. So thank you, the entire network, I would say.
No, so the next slide is just an example of one of the results of a networking event, where we, like from the catapult, where we got a tip about an Irish potential competitor that we should look out for, which weren't a competitor at all, but we have complementary products. We can go on the same line. We started looking into, what can we build from just the two of us. We added a third product from like a digital device on it, and from the matchmaking, we got these two hospitals, the Spanish and the Portuguese hospital, to do the clinical study of our now 3 devices, and we managed to convince the European Union, the EIC, to fund this project. And it's born from networking, from meeting people that you share the same values with, someone who is eager to help the patient, help the nurse's situation. So it's the most amazing thing, honestly. And you could never leave this, I think. If you start with medical devices, it's impossible to leave this field. I don't think we have any more slides, really. And I realized that we haven't really spoken about all the problems and challenges and everything that we have faced along the way. So maybe, if you want to ask something specifically, because it's never been easy, but it's been fun. So
thanks, Rebecca and Katarina. It's a very strong entrepreneurial journey. Thanks for sharing, the both personal side, but also the business side. And I think it showcases how the two has to come together, right, to really make it happen. And it looks like you've managed a lot in a very short amount of time. So congratulations. It's such an unmet need. Can you also maybe share the last 2 years, how the company kind of managed the uncertainty around the pandemic, and how it kept growing whilst the uncertainty was growing, maybe for people who are going through the same stage? And sorry, in the meantime, if anyone has questions, please drop them in the chat for Tata Medical.
But it's sort of even embarrassing to say that we have scaled so incredibly fast, and it is during the pandemic. It's been everything coincided with the pandemic.
And also that, the hospitals keep on taking the calls and booking the trials, and during, when we know that they are really, really busy, but still they find this so important. And we managed to get the CE mark down during this time. You have to speak to users during this, and it was impossible to go into the hospitals. But then we rented like a conference room outside, and the nurses pass it because on their free time, because they find it important.
Right, and this also shows that they're really endorsing the solution, and there is a need. So it's a further validation that even through a pandemic, it's a solution that can scale. So really congratulations. And as you also said, really claps to EIT as well, supporting startups and scale-ups like yours in growing. And Miriam Irle, in the meantime, commented that it's been a fantastic journey to be on with you. So it's great to see community coming together. Thank you, both of you, for sharing your story. I'm sure we can learn a lot from you.
Thank you so much.